written you up. If you're live.
All right, so I'm going to call the Monday, December 5th, 2022 Community Wellness Committee meeting to order. And so the roll call, Councilmember Falco.
Here.
And Councilmember Murphy is not here, and I am here. Did you have an opportunity to review the minutes?
I did look at them, yeah.
All right, so I guess we will approve those then. So thanks for coming, everyone. I know that we didn't have kind of a full group here with the mayor not making it, but I figured, I really want to make sure we got kind of the next steps underway. We kind of left a couple things hanging, just want to kind of double back to them and make sure that we are able to move things forward and kind of wash your hands, if you will, some of those things. So the one was the Community Wellness Summit notes, and I sent those out to you all, I think, in September, October. I think we were good to go, but I hadn't heard any feedback. So are we good with those?
Yeah. I
Okay,
think
good.
that was good.
Good. Can you send me, is it possible to send me the whole list of everyone that was there? Or does the spreadsheet have the names of the numbers, or that? Emails for everyone?
You know what, I think I did send something, but I have an attendance list and like the organizations that they're with, and I can send that out again to everyone.
Great, if you can send it to me. I'm sorry, I didn't, I should have probably looked, but I just want to make sure we were okay with the notes. As long as we're okay, then I want to send that. That was one of the actions we at least promised folks that we were going to do, was to send that out there to everybody else. So excellent, I appreciate that. I think linked to that then is the Community Wellness Organizational Database, and we had talked about the value of that at the summit, and we had talked about it here, I think, in September when we last met, but I don't think we've kind of arrived at any kind of actionable types of steps. I think we were going to build it out a little bit more, so I figured we would want to try to spend a little time today to talk about what those next steps should be, how do we build it out, and then ultimately, I guess, questions like, where does it live? I would love to be able to kind of turn it into something that's like a Google type of thing where it's editable by other folks, so that they can get in and begin making entries, so it's not just upon this committee to kind of update it. So I was going to turn it over to you all for thoughts.
Okay, so I did start, compiling contacts with the different organizations that could be included on that, right, with the tags. I'm not a website expert. I have a little experience, but making them, but I know there is a way to, for someone to create that kind of database and tag those things. So as far as where it's housed, I think probably either on the city website somewhere, or what is that new website that's being made that has all the ad hoc?
All for Oneonta has all the ad hocs.
I wonder if that's a good place
Wait,
for it to go.
What's that called?
All for Oneonta.
What's that being run through? What is that?
That's something the mayor's working on.
So is it going to be part of the city domain or separate?
My understanding is that it is separate and maintained by an intern.
But it's affiliated with the city. All for Oneonta?
And that's going to be a compilation of all of the ad hoc committee materials.
Is it allformoneyonta.com?
There's two. There were some domain issues. I'm not sure which is going to be the chosen.
Okay. So you're saying that would probably be the appropriate place to keep this?
I think Community Wellness Committee would be more appropriate on the city website.
Okay.
Public body. Sorry.
Okay.
No, thank you. But then, as far as this database goes, we want to be able to create a resource that, all these organizations can reference, right, if they want to find contacts for. Just to kind of create one space where if people are new coming into an organization, they can see pretty quickly, right, what is available and who they can contact.
We had something similar to that on a smaller scale on the previous iteration of the website, and it was boxes on a page for information on housing, click here, and it gave a list of organizations. For information on mental health services, click here, and it gave a list of different organizations.
Okay.
So you mean it was like a hyperlink on the same page that,
On the
okay.
exact same page, yeah.
Right.
The boxes were static until you clicked on them, and then it dropped down and.
Oh, like a little drop
Oh.
down. Oh, that's like a pretty simple way to maintain it, and then it's not because it's not, once you get the initial data in and the initial links in, it's not gonna be a ton of updating. It's not like,
It's less content to update that way, yeah.
yeah.
If you're talking about individuals, there's a lot of turnover around here, so.
I think more, I don't think it should be individuals,
So it'd be
it
like-
should be more like organizational
Organizations.
websites. Yeah. Because they, in theory, should be updating their contact lists on their websites.
So you could say, please contact the outreach coordinator at such and such, and then they can go in there, they can use that.
So like a list of organizations like Otsego County Mental Health, opportunities for Otsego, that kind of thing.
Yeah, we had them, we had like MCAT, we had like all of that, and some of it was to their website. If they didn't want to provide a website, they felt it was more appropriate to have a singular person by email. We had one institution that said administrator at, and it provided their address, and it would open an email, so.
Do we still have, I mean, I know we have the new website, but do we have those pages still created? I mean, is that something we could just piggyback right on top of and?
I think I have it saved, I'm fairly certain I have it saved.
Okay.
We didn't delete any of it, it's just what got hidden and what got,
Right, sure.
when we moved it over,
Okay.
yeah.
Right.
So turn to you here, Gary, for then what do we need? What kind of format would we need to have that in? How do we create an action out of that and actually get this working?
Provide me with organizations and links, and I make it happen.
You know, so I created like my own tags kind of in that list. But if you wanna maybe email me like the ones that you have already, I can go in and like adjust that spreadsheet, so that way it'll just be like, oh, okay, this is what we want under this one.
Under this one. Yeah.
Some of them might repeat too, because some of these organizations, right, like have several different things. But yeah, I mean, I feel like as far as getting something up and running, you know, why reinvent the wheel
Sure.
if it's already kind of been done?
Right, yeah, exactly. Chief, in your experience, I mean, just thinking about, I mean, do you know that, was this something that folks used, or do we now need to try to go out there and promote this to other organizations? I mean, how do we get this, I don't want to just put it out there, we're done, great, but how do we get folks actually accessing it? I mean, did people in your experience access it? And Doctor, I guess that's to you as well, with your understandings, did people access this site?
Yeah, people that are looking for assistance from those particular places would access them. The trouble is the people that don't and won't.
Right.
Mhm.
Right.
Would there be like a heading, like you go to the city website, what would the heading be for this repository of resources?
We had, and I'm trying to find it buried on the site here, it's still there. We had it essentially being local resources. And you would just click on it and it would have everything on there. So you wouldn't have to necessarily know what you were looking for. You could just find
So
it.
the drop-down menu might say mental health, or.
It was all one page.
Okay.
So there were boxes, 4 boxes across, I wanna say 4 or 5 down. They were all different colors to show some sort of separation. And it would say mental health. I think we had education, we had medical. So people could click on them and say education, there would be a link to SUNY, a link to Hardwick, a link to the city school district, DCMO posts, like just anything that somebody had said, hey, you know, we're interested, we can help provide you with that service.
Right, okay. All right, well, I think, guess let's roll on with that then, and then, you know, are we able to track our hits on each of the pages?
We can, yeah.
It might be interesting to know once we get it up, what kind of hits we're getting, and then, you know, making sure we're also sharing that with our community partners and everyone else as well, and trying to surface a little bit more so that people know to go there as a resource. I guess my only concern is, and then I want to hear from both of your thoughts about it, but is, as we just talked about, maintenance of it. So then, how do we maintain it? I mean, beyond just, you know, not having the names of people, but how do we maintain it if there's other organizations, if things take, you know, change? How do we keep it as a very kind of up-to-date site.
That's the hard part.
You know, that's the hard part. Plus, if you have, let's say, for instance, an administrative link that people might email, I find that we get all sorts of stuff like historical, people contacting the website as opposed to calling. It's difficult because you really can't parse out like something that's a big issue versus something that's a small issue. And if it's all going to the same place, then it has to be monitored. And then having somebody that's not going to have their eyes glaze over getting 150 emails a day
Right.
for one, you know, it's difficult.
Right.
It's like it's information overload.
Right.
Mhm.
You know, so how do we parse that out? So it becomes more like, I think, if they have a number for assistance, right? Call us if you need something. Something more specific than like, let's say necessarily an email, like a web address would be great because then they can navigate it on their own.
Right.
Yeah.
So like more general information and nothing that's gonna be so specific. So I would, you know, if we could do the hyperlink, I would hyperlink it to their website,
Yeah,
you know.
yeah.
Yeah, it's by admin email address, I meant like to their admin.
Yeah,
We're not,
yeah, not the city admin.
please.
But even then, like, I mean, the city admin stuff,
Yeah.
we get some pretty interesting stuff that comes through there, and it's just not an appropriate place to be, you know, depositing a call, for instance, about a person in possession of a firearm on a Saturday, so that we can pick it up on Monday.
Right.
You know, so like having that directed right to the police department would be appropriate. But the problem is now you have, you know, we have Facebook page, we have an admin website, we have Twitter account or whatever. It just may not find a home.
Right, gotcha. So then it would be more appropriate to have the number of the organization and the website, and maybe back away from the email address, is that what you're suggesting?
Yeah.
Oh, yeah.
Right, okay, so do
Yeah,
you,
now it's like so much work. And even when I worked for Springbrook, like I did, you know, I'd have to maintain the website for Southern Tier Connect, and we had a ton of links on there, you know, because it's basically like, it's a care coordination organization, so it's basically like collecting resources for people, right? And like OPWDD would change their links all the time, you know, and just maintaining that alone was enough. Like, forget contacts because if there's turnover.
Sure.
right,
But there's like,
But
Terry
phone numbers
probably
don't change
knows,
very
there's like programs, you know, there's things in, behind the scenes you can run and search for broken links, and then it's just a matter of having someone like find out what the new link is now, you know.
well, I wonder if that's
And then-
something, speaking of the mayor using interns, is that something we could task an intern
It'd be
with?
very appropriate.
Yeah.
Right.
I believe there is one that is web-based.
Okay, a
Web-focused,
web-based
web-
internship?
Yeah,
All right, and they're gonna be ongoing?
mine through the year.
Okay,
So,
Great.
so that will at least address that
Yeah.
issue.
I mean, that's not like it's not a, I mean, it seems like a big project, but it's not like that overwhelming of a project.
It's just time.
It's just
Right.
time.
That's
yeah.
really,
Especially if you're given all the links.
So right now, do you have the numbers and the websites? I mean, is that gonna be pretty easy to load?
I'm pretty sure I have all that, yeah,
Okay.
now.
Great,
At least from the people that all attended the Wellness Summit.
right,
And
right.
then, I mean, I don't know I can't remember where I left off, if it was like a Google sheet, or I can't remember what it was, but it's been a while.
Right, right.
But I can resend it, and then if you wanna add to it, or,
it was an Excel file.
it was an Excel, okay.
Oh, yeah, great. Good, yeah, I remember looking at that, and so now I'm remembering how we have the hyperlinks with all the different, not the hyperlinks, but the category links in terms of what they were doing, so,
Mhm.
good. And maybe, can we do that as well, have some overlap, some of these groups will have some overlap
Yeah.
as well? Okay,
Yeah.
beautiful. So let's then move forward on that, I guess then, if you can get Carrie the information, meanwhile, I would love to talk to the mayor and see that he, you know, can he commit some of the time of the interns to be able to work on this as well, and making sure that they're working with us, that they're updating this, so that we kind of have that commitment moving forward. I don't want that falling onto your shoulders, or, you know, just kind of think about sustainability of the project, that it can live beyond, you know, any of our times here in the city, that there's some kind of, you know, commitment to maintaining it.
So I have a question. Understanding this is for the public, and this may have happened already, but did we, send out correspondence to the participants so they could connect directly with one another? Like, that would be, to me, an appropriate place to use emails, so
I
that,
think it would be great.
you know, part of the purpose of the summit was to facilitate networking. So have we followed up with the participants so that we can connect them to one another? Did that happen?
I believe so, yeah.
Yeah.
After it, I remember sending to everybody the list, the contact list
So
of
they-
everyone that was in attendance, so they all had that,
Good.
those contacts.
Maybe what we can do is just tag that right in when we send the notes, is just tagging it again, that Excel sheet with that to everyone, and that's one more time to be able to reinforce it.
Oh, the Excel sheet that I made with the
Or
contact.
whatever the contact, yeah, I mean, whatever it is that you sent, maybe we can send it again when we send the notes, I guess is what I'm saying.
Yeah, well, okay, when we send the
Right.
notes from the summit, yeah, like here, just a refresher, like, you know, again, like this is everyone that attended and their contact and,
Yeah,
yeah, I'll have to take a look at that,
Yeah.
list, cause I can't remember if like some of the contacts, in some instances, it may have been a little unclear, like if they were, what organization they were from. I can't remember if I resolved that or not, but
Yeah.
I'll dive into it, I'll take a look again, and
Okay.
then we can send the notes. So
Yeah.
I'll send you that attendance sheet, and then you would
Beautiful.
like to send out the,
Yeah.
to everybody?
if
That'd
that
be
makes sense,
great.
or if you want to,
That'd be
whatever,
great.
I don't mind taking the work on that, so,
Okay.
good. So, yeah, then get it sent over to me, and then I'll put it out there, and on we go. Is there anything we're missing on that B in terms of the database? Good.
Mm-hmm, I think that sounds good, like a good plan.
Well, that was, C is a little redundant, sorry, the planning for meeting of children's services meeting, don't mind me, it was late. So just, this was the last thing we discussed, was trying to pull together the children's services organization, because one of the things coming out of the summit we recognized was that there were, you know, and Chief, you've been saying this all along, that there's this huge need for services for children. I think, Dr., you've been saying the same thing. So trying to pull people together. So I guess I wanted to begin to think about when would we do this? And then, most importantly, what are the goals here? What do we hope to accomplish by pulling this group together? Is it another opportunity for them to be able to communicate with one another, recognize where the gaps exist and strengths? Or, so what do we hope to accomplish this? So I guess let's start with that question first. I think there's certainly value to getting the organizations together, but is there value beyond that?
I mean, yeah, I think you kind of nailed it. I mean, I think it would be, I guess it would be beneficial to have those services, because they might even be, you know, to bring them together, they might even have contacts from other organizations outside that they want to bring in. It could even extend to the surrounding area, you know, I don't know. Like, not to bring it back to like, when I was working with Southern Tier Connect, but like, there was like a need for, in that community, like sedation dentistry, and so like, I was doing a lot of research on places in Binghamton, you know, or, you know, so I don't know, maybe there are other services in surrounding areas too that we could bring in, and maybe that's its own category eventually on this health and wellness resources page on the website. So,
Yeah, sorry.
yeah, no, please.
No, I'm thinking, are you thinking it then may lead to a specific project that we could endorse or promote or support in some way? If we recognize a clear need? Or is it just like the summit, we're bringing people together around a certain?
Right, around a certain
I
group.
think
maybe.
what would end up happening is you call a group of people together that are stakeholders in, let's say, different respective areas, and what happens is you can talk about broad generalities for a period of time before things start to get boiled down into more specifics, and then the specifics become difficult because physicians are siloed, psychiatric providers are siloed, community resources are siloed, and without like clear memorandums of understanding regarding confidentiality and rules, communication breaks down and you end up in a position where you're talking in initials to see if somebody can guess the name. Like, it becomes really difficult. And the other thing is I think a lot of providers, and I'm just throwing it out there, I've had issues with, especially HIPAA, if it's a justice-involved issue where the police have a legitimate need to know, they're still reluctant to give us information based on HIPAA. That's not the case. So I think a lot of it has to do with education, but I think what's going to happen is you'll find you can speak in generalities for a period of time before it starts to boil down and become more specific, and really what we're talking about is a very small population of people that really, in order for us to best serve them, we need to be able to discuss. So that's where you're going to end up coming into the, because like they don't necessarily talk about things specifically. You have to have some sort of a consent waiver, or you know, it's difficult. Which is something I'm working on tackling right now.
So it seems.
You got to start the conversation generally,
Right, right.
Yeah.
but you really have to have an eye on the fact that at some point you're going to start running into, I can't really talk about that.
Right. So then, I mean, is there, just trying to think strategically then, if we keep it general, try to really keep it at that level, and try to identify, and kind of trying to tie in what your point was, is try to identify several projects that might be able to come out of this group, you know, actionable types of things, whatever they might be, that would kind of meet some of the gaps that we know that are out there. Does that seem to have a purpose? I mean, does that seem to make sense? Does that kind of keep us moving forward, or?
No, I think you have to have the conversation. I'm just trying to say, this is my experience, right? And then you have to have an eye on, at some point the conversation may break down, just because I can't talk about it, something might come up. And there are ways around that, but just be, you know, anticipating that moving forward, you might be able to steer the group a little bit better, or come up with some means of addressing that issue.
Gotcha, okay, it's just an FYI for us to really
Right.
keep in mind as we are having these conversations, that we might hit some walls that are impasses that are based on that kind of very specific knowledge, and maybe not based on what we need to do moving forward.
So like 99.9% of the population is generally law-abiding, right? It's that 0.1% that's generally the people we deal with on the most frequent basis. So having the ability to deal with that specific group candidly is really important. I have a feeling that it's very much the same way in a lot of other professions, mental health providers, however it be. There's a very small fraction of those people that are in need of the most intensive services. Some of them never seek them, but we have to be able to have that candid conversation about how it is that we might be able to address that through other disciplines, right? And if I'm siloed off and I can't talk to you about that person, you can talk about that person over here, and it's just going to go into you're yelling into the ether.
So it sounds like breaking down those silos might be something that would be
I think that's really one of the biggest things that stands in the way of making real progress, is that there's a lot of silos.
right. And HIPAA influence silos, but some, I guess, but.
Ethical, HIPAA, there's, if you're an attorney, there's client privilege. I mean, there's some real legal stuff there too. Infancy, right? If you have a juvenile, it becomes increasingly difficult if you're trying to address a serious issue, if you can't discuss it openly.
Right.
And one of the things that I've heard several times here throughout whatever the past, I guess it's almost a year that we've been working on these types of things, having these conversations, but is child health and mental health. Is that, and then there's talks about Bassett opening, maybe having, or am I mixing things? Is there some kind of mental health that Bassett might be addressing with regards to children? Is that, am I off base on that? Remember
Well,
that correctly?
I think they're working on re-establishing an inpatient presence at Fox. I'm not
Yeah.
sure if that would specifically be for adolescents or not. I think they're well aware of, you know, the gaps in services for child mental health and adolescent mental health.
I think painfully so.
Yeah,
I mean, they had somebody there they couldn't do anything with for like 90 days, was a patient at the hospital they could do nothing with.
Wow.
So, no beds, no facilities, like,
Right. So is that something that, if that seems to be one of the big things, is that something that we can have any influence over? I mean, how do you even fix that problem, even to begin to imagine? That's not something you can get a grant and all of a sudden do, I imagine.
I mean, it was like, they're enormous issues.
Yeah, right.
You know, the New York State closed 30 prisons this year and last, I think. What are the plans here? Have they come up with any statements as far as where they're putting the money that they've saved?
Yeah.
I'm not hearing anything about like mental health initiatives right now.
but maybe getting the players together in a room is the first step.
Well, I mean, it's the only logical thing to do, because who do we have? We have who we have right here, right now.
Right,
Mhm.
What can we do with what we have?
right. That's our
And-
resources, that's what we've got.
And being able to identify the needs of individual people so that maybe you can work across to, let's say, social services. I mean, like the schools too, it's like, you know, if we called up the school and said, hey, you know, what issues are you having? You're gonna say, well, this is a school, I don't talk to you about the stuff that we've got going on at the school. That's between us and the parents,
Yeah. Yeah, it's tough.
right? So it's like,
It's tough, and even if you get these people together, even if they call, I don't even know, like you said, I don't know if they can even call each other on a one-on-one to talk about this kind of stuff. You know?
it's tough because they're difficult conversations to have with people that want the services.
All right, so we have a pretty clear need to have a meeting. What next will probably need to be determined. We know there's gonna be quite a bit of roadblocks. Chief, you've already mentioned a few. We recognize the roadblock is we just have already big holes in our services. But at least beginning to have the conversation about, you know, where are we at? What do we need? You know, where do we go from here? What can we do together? So what is a reasonable time to have this meeting here? We're gonna be talking about probably less than 10 organizations, I imagine. We made the list the last time, I'd have to look at my notes, but we made a pretty decent list. What's a reasonable timeline for this? Early February, sometime mid-February, March? What do we?
I think early February would be, I mean,
Yeah,
especially if you
that's
reached out to
true.
people by email, I mean, you'll get responses pretty quickly,
Right,
you know, and then it's a matter of like picking a date and time and.
yeah. And I'm thinking this is my thinking, a little bit more low-key, rather than try to have something up on campus or anything else, is friendly, perhaps just to have it right here in the
Yeah.
downstairs conference room and just bring everybody in to have that meeting here.
Downstairs conference room isn't,
It is not available.
we have the mayor's conference room,
How many people does that seat?
10 to 12-ish.
So I'm just throwing it out there, like I've made a really big
In here.
commitment to having all of my meetings by Zoom. And the reason is, there's people that are busy all over the place and like could be in Cooperstown or the far reaches of the county or out of the area for whatever reason, and they can make a half an hour to pick up a Zoom meeting. But to
Right.
ask them to drive across the county, you know, I just had somebody on my meeting the other day from Cobleskill, you know, it's a lot easier for us to, and I think the content is there and people are having good conversations. But getting everybody into a room anymore is like it's becoming increasingly difficult.
Yeah.
good point. And frankly, I'm thinking about myself, I could much more easily jump into a Zoom meeting during the middle of the day than try to get out here. I mean, the extra time it takes just to get here and, you know, would cut down on things, so, okay, that's the point. Well, Dave, do we still, are we able to set up a Zoom? Is that something I can work with you on and be able to set that up? Okay. Good.
But you're not thinking, I mean, are you thinking that this is open to the public?
No, I'm thinking this is just, let's
Like kind
get
of the way our summit, the
Right.
summit
a
was.
scaled down summit.
And we'll be there to take notes
Right,
Yeah.
maybe to kind of
and facilitate.
facilitate the conversation, take some notes, and kind of go from there. I mean,
Mhm.
right, so really kind of put the ball into their court is here, you know, we're trying to bring this all together to try to see if there's things that we can take action on and what we need to take action on and, let's facilitate the conversation. Okay, then, let's try for then, I guess maybe mid-February would probably be best and see what we can come up with. Chief, are there any days that we should stay away from for you or your schedule?
I think Monday, late afternoon, evening, Wednesday and Friday are generally pretty good for me.
Okay. Tasha, how about you?
Pretty flexible and open.
Okay.
So my question is, are these people and organizations were invited specifically to do with child and adolescent mental health, or all services for child and adolescent? What is the real focus of the invitees?
Yeah, I think that's a question we haven't yet answered, so I guess we should probably explore that. I mean, is it mental health or is it all services? My thinking was to narrow it a little bit more, that we were initially talking about mental health issues was the thing that we thought was the most pressing issue that we weren't addressing.
So, my experience is that we generally share people across disciplines. So, you'll see that somebody that's involved with the mental health systems are also involved in some way with social services, is also in some way involved with emergency room services, is some way involved with, so they all kind of like touch each other. And the more people that you get talking about the issues, the more we start to realize that we have stuff in common than we don't.
But I think if you tell them, and I agree, I think you want people there from the schools, from the healthcare field,
Yeah.
but if the focus is mental health, that will at least help drive the conversation and not have, hours spent on why there isn't dental care for our children, which is important.
Yeah, sure.
But I think it's also important to somehow structure the conversation so we have control of it in terms of what we're looking for.
But it's also contributing, right? So if we have housing or food insecurity, we're talking about issues that negatively impact mental health, so they're all kind of like,
True.
Right.
Yeah.
it's really hard to parse the stuff, or, when you start digging into it, it's like, we're all in it together.
Right, and then you get into substance use, and it's all interrelated, of course, but,
Well, I guess then let's keep the topic close, mental health, but throw a wider net
right.
with regards to who we invite, which is.
It'll distill itself down over time, I'm sure.
Right, and we can acknowledge the reality that we know that food insecurity, we know that housing, we certainly heard housing loud and clear at the summit in August, are impacting these. We recognize there's a lot of other things, but we're really trying to focus on this particular piece, which it seems to be one of the largest holes that we have in our community right now. And so what can we do? What can we think about that?
Yeah.
Okay. So what I'll do then is put together the list of groups that we talked about last time. But if you all have groups or individuals that you think should be part of that, you can let me know, and we'll start trying to create our list of people. Maybe we can do that pretty easily by email. And then once we have that, I'll put together a letter or an invite letter, send it out to you all, and then we'll get it out there. I'll also try to then figure out what would be a good maybe February date, I think Monday afternoons would be good, so we can, does that work for you as well?
Sure.
Okay, then we can see what, if we've got a good date. I don't know offhand what dates in February we've got. We wanna just try to pick something right now?
Yeah, I mean, I don't think I have anything going on in February, so.
The depths of winter.
Something to cheer us all up in the middle of winter.
That's like right in the middle of winter too, it's like February.
Yeah, February and March are like the roughest months up here.
Nobody's gonna wanna drive, it's like a perfect time to have a Zoom meeting, cause
Yeah,
everybody's gonna be like, it's 12 below zero, I'm not leaving my house, oh, got something to do.
Zoom meeting, totally, right? And they won't be busy doing other things either, because there's nothing to do.
Yeah, unless they were on winter break.
Yeah, which I don't remember what.
Week of the 20th.
Oh, so before that maybe.
Probably be a good idea.
Winter break for the local schools.
Maybe the 6th
So
or the
then-
13th?
Yeah, 6th or the 13th looked the more likely.
If you pick the first one, you'll have the second as a fallback date.
Right, well, the 13th is probably best for me, but can also do 6th if needed. Would the 13th work for
Yeah.
everyone
I
else?
can almost, I'm pretty sure that there's nothing on my calendar in February.
Lucky.
I mean, exactly, I've already got filled dates, it's
Yeah.
pretty scary. So we'll try for the February 13th date as our starting point, which should be pretty easy though, if we don't need rooms or anything else, just got the Zoom link. And then fallback would be the February 6th. What time are we thinking would be best? 3 o'clock meeting, a 4 o'clock meeting?
Doesn't matter for me.
It doesn't matter for me, I mean,
We could see
3
what
o'clock's
people's
normal.
availability is like, you know. Maybe once we get the list, what are those things called, like doodle poll,
Right.
you know, and like see what time works best for
Okay.
other people, see if you can find one, and if you get like.
Okay, so, I will get you all the list of what I have, and then if you could be thinking about individuals that you know, or organizations you know, with contact people, so we can add that to that list. And then I'll put together the email to send out to folks to kind of invite them. You can put a doodle poll attachment and, move that along and figure out what, hopefully the 13th would work. Maybe we'll offer them both those times and just see what we've got.
Okay.
Does that work?
Sounds
All right, so I've got some homework there. Anything else? Like I said, D, anything else?
I think this is good, moving the ball, keeping the ball rolling.
Yeah, I mean, you know, it's like, it's obviously a tough ball because, well, it's a tough issue. All these issues are tough, but I think just trying to keep on trying to chip away and do little by little, you know, hopefully we can try to do some things. And there's been some interesting developments around a lot more kind of planning amongst some of the nonprofits. And so I keep trying to plant the seed that what we saw was that the groups that were at the Wellness Summit felt a strong need to continue meeting. And there's an organization that seems to be kind of doing some of the organizing the nonprofits around other things, but I keep trying to plant that seed of, can this be added to the mix? Can you get the kind of wellness organizations together to have periodic conversations? Because that was one thing I heard from that meeting as well. And again, trying to play the role where we're not doing everything, but maybe the other groups are facilitating these, and we're just kind of trying to jumpstart the ideas or jumpstart the communication and
Right.
break down the silos to use your analogy from earlier. So, we'll see.
That sounds great.
Yeah.
I did, and after I think our September meeting in mid-October, I did reach out to Nicole Blanchard from Bassett. And I shared our list with them, but they had really progressed to the point where they were in development stages of very specific projects. did I talk to you about this? I talked to Chief Knapp about it. One of their very specific projects was called Rescue Divas, and they wanted to base that in the city here, based on a similar program in Wisconsin where they take middle school aged females and expose them to careers in emergency services.
Hmm.
So, I thought that was, I can circle back to them. I hadn't, because we hadn't met since, but, I said I could certainly be the point person to help connect you and Chief Knapp in terms of what we could offer.
Yeah, for sure.
Because I think they have all these ideas, they need to implement things, right? That's they have this grant, they need to implement projects, and I think, a lot of them, the city could partner with quite readily. There was some having to do with overdose backpacks, extending 4-dose services, yeah, so,
So when you say that they need to do things, what is the grant specifically focused on that they need to do, they need to address?
well, their grant was for population health. So there we're needing to recognize projects,
There's a lot of
That
statistical
impacted
breakdown.
population health. They started with their own community needs assessment survey, and then came up with an improvement plan, and from that have now developed some very specific projects around the issues of mental health, around the issues of substance use, abuse. Another one that had to do with a collaboration with BOCES and Office of the Aging, around housing, a work group for senior housing. So there, I think there's some opportunities. This was, again, almost 2 months ago I talked to them. So they were, by the end of December, gonna have all of these projects more developed.
Wow.
So I'm happy to reach back and to say, where do you wanna partner with the city?
Yeah.
I like the work that they're doing, I think it's really interesting. But looking at some of their demographical information, the demographics of the city of Oneonta are a stark contrast to the rest of the county.
Yeah.
I have been doing a little dabbling on my own regarding demographic information for the city, and I've come up with some really interesting numbers, like 41% of my population is between 18 and 24.
Mm.
You're meaning, oh, wow.
Our
Our
population.
population, wow.
Well, that includes the college kids.
Yeah. There is not another college town that I can find that's even close.
Right.
Yeah. Wow.
It's also like a really high-risk demographic.
And so much in that other college towns have higher, like,
No,
they have much lower. I mean, they have higher, like,
right, they're generally
older
like
populations and,
20-ish%.
wow. That's wild.
The information's out there, it's not hard to find, it's just, it's a really challenging place to be, because those are a lot of people that make some very good decisions and some pretty poor decisions, and it's, it happens to be nationally one of the highest crime demographics for both offenders and victims.
Do you have representatives from the city on your, I'm sorry, from the city, from the colleges on your group?
I'm sorry?
Do you have representatives from the colleges on your group?
Yeah, I do.
You do, okay.
Yeah.
Seems like that's an important, keeping them involved as much as possible, since they have, to some degree, supports on campuses. But yeah, ask the question of how do we, given our.
It would be interesting to see like somebody really do like a scholarly study of the breakdown of the population of the city and some of the issues that arise from that.
Right.
And that's something that you won't be catching me doing anytime soon, because I'm already in information overload, but there are some interesting things about the city that create work for us. And I should be at least, rudimentally aware of what those issues might be.
Right.
Yeah.
Dr. Georgeson, for your situation for Bassett, when you communicate with them, I wonder if they'd be interested to share that needs survey that they did. I would love to I mean, I know some different organizations have done, but I'd love to see what they came up with. I don't know if they would feel like that's something they don't wanna share, but it'd be really
I'll
interesting to know.
reach back out to them, yes.
Yeah, that'd be great. I'm curious whether that reflects what you've just said, you know, if there's some ideas there.
Well, I think it creates a, I've said for a long time, Oneonta is a really interesting place because we're an oasis in the middle of about 50 miles of forest.
Right.
And we see problems that get imported here from elsewhere that in other places are big city issues that we do not have. I don't have an assistant U.S. Attorney's office or an FBI office or a DEA office or
Right.
a large police agency other than the New York State Police as a neighbor. We're on our own. So, how do we overcome some of those challenges? And we've had some serious challenges. Like we had one of the first prosecutions for major drug trafficker in New York State right here in Otsego County. We've had a lot of firsts here, and some of them not so great. But we just don't have an awful lot of local support. We're really kind of on our own here.
Right. Interesting you put it that way, I hadn't thought about that.
Yeah, there's places like Oswego that have large police agencies not far from where they are.
Right.
Close,
What is our-
close personal or close working relationships with the Department of Homeland Security, Border Patrol, for instance.
Right.
What
What is our closest kind of large law enforcement beyond state police? I mean, does
the next largest police agency from Oneonta would be Binghamton.
Binghamton, okay. Challenges. And as we know with the budget tomorrow, they look at challenges all the way through our city. Challenges, how do we come up with solutions? All right, well, thank you everyone very much for your thoughts, and I'll get stuff out, and if you get stuff to me, I'll send them out. And then I guess do we have a meeting for January?
We do. 2 seconds.
Thank you very much. You gotta get a little more organized as well. You know, when our next meeting is.
I'm going to be away for a little while in January.
So I have a question. When I showed up for the last meeting that didn't happen, Katie was here saying she was gonna be part of this committee now. Is that what
Yeah.
happened?
Yeah, Mark is switching things up.